All right, let's dive right in. Today we are tackling a topic that is, no exaggeration, a core safety function of your role as an enrolled nurse. Getting the difference between an allergy and an intolerance right, it isn't just important, it can literally save someone's life.
And this quote right here, it really just captures the massive responsibility on your shoulders. It's exactly why understanding this distinction is, well, it's absolutely non-negotiable in your practice.
So our goal today is to really close that critical knowledge gap. By the time we're done here, you are going to have the confidence and the clarity to act decisively, to act correctly, and to keep your patients safe. Okay, so the most crucial point to start with is that these two things are not the same. They're not even in the same ballpark. We're talking about completely different physiological events, and that means they require completely different responses from you. So, think of an allergic reaction like your body's security system just going into total meltdown. Its job is to fight off real invaders, right? But in this case, it mistakenly flags something harmless, like, say, penicillin, as a major threat. This triggers a massive release of chemicals like histamine, and that's what causes that huge system-wide reaction. Now, on the flip side, an intolerance has absolutely nothing to do with the immune system. This is usually more of a mechanical problem, a digestive issue. Like with lactose intolerance, the body just doesn't have the right enzyme to break down milk sugar. The body isn't attacking it, it just can't process it. It causes digestive chaos for sure, but it's not an immune system crisis. And this chart? This really just lays it all out, crystal clear. You can see the huge differences, immune system versus digestive system, how fast it happens, and, of course, the big one, the potential to be life-threatening. This right here is where it all just clicks into place. So, okay, how does all this theory translate into what you're actually going to see at the bedside? I mean, knowing the textbook is one thing, but spotting these signs in a real person in real time, that is the skill you have to master. And you have to be so vigilant, because these triggers can be hiding in plain sight. It could be that antibiotic you're about to give, the food on their lunch tray, or heck, even the latex gloves you're wearing. Being aware is your absolute first line of defense. Now, these are often the first warning shots. A sudden rash, those hives, maybe some crazy itching, or the patient just tells you they feel off or really anxious. These are those first signs that the immune system has been triggered, and you need to start paying very, very close attention. But when that mild reaction starts to escalate, it becomes anaphylaxis. And let me be perfectly clear about this. This is a full-blown medical emergency where every single second counts. Your response has to be immediate, it has to be precise, no hesitation. The very first and most critical thing to look for is a compromised airway. Is their tongue swelling up? Does their voice suddenly sound hoarse or raspy? And listen for stridor, that high-pitched whistling sound when they breathe in. That is a major red alert. Next up is breathing. That chemical storm is now attacking the lungs. You might hear a wheeze, see them struggling to get a breath, or notice this persistent hacking cough that just won't stop. Then you've got to check their circulation. This whole reaction can cause a massive sudden drop in blood pressure, sending the body into shock. Look for dizziness, pale and clammy skin, or a sudden collapse. Their pulse might feel really fast but weak. And finally, a really key sign is a sudden change in their mental state. You'll hear patients describe this profound sense of impending doom, just this overwhelming feeling that something is terribly, terribly wrong. And I want to be clear, this is not just anxiety. It is a very real and a very serious physiological symptom. Now, just compare those life-threatening signs to what we see with a severe intolerance. The difference is just stark. This is all about severe discomfort, and it's almost all centered on the GI system. Yeah, it's painful, it's distressing for the patient, but it is not an immediate threat to their airway, their breathing, or their circulation. Okay, so knowing the signs is half the battle. Now, let's get into the most important part. What do you actually do? We're going to cover both that high-stakes emergency and the kind of management that's focused more on patient comfort. This right here is the protocol for anaphylaxis. And look, this isn't a suggestion. It is a sequence of immediate life-saving steps you have to take without a second's hesitation. Stop the trigger, call for help, assess, position, assist, monitor, and document. This flow has to be pure muscle memory. Now, compare that emergency response to managing an intolerance. See how the urgency is different? Your focus here shifts. It's about getting the substance away from them and then providing comfort. Maybe that's pain relief or anti-nausea meds. You'll monitor them closely for dehydration, report everything to the RN, and of course, document it all. It's a measured, supportive response. Of course, the absolute best way to manage any emergency is to stop it from ever happening in the first place. This, right here, is where your proactive nursing skills are just everything. These 4 steps have to become an automatic reflex in your practice. Always ask. Always clarify what kind of reaction they have. Always check the chart and that red wristband. And always, always double check for allergies before you administer anything. Think of it as your personal patient safety checklist.
So, let's take all this knowledge and put it directly into your very next shift. It's not just about asking, do you have any allergies? It's about asking that crucial, clarifying question, and what kind of reaction do you have? Honestly, that single question could be the most important one you ask all day.